To me what your symptoms were.
It was almost like sciatic nerve situations going down both sides.
1 to 10, how bad was that pain?
It got to the point where they would say 1 to 10, how bad is it? I couldn't really tell them because I was getting used to it.
Yeah.
Then I aggravated it again
Yeah.
in August, lifting a mower out of the back of my pickup. Went to my chiropractor and he said, no, that was on the 29th of August.
Yeah.
He says, you better see a doctor.
Yeah, and that was about 4 months ago. How long before that have you been how long have you been dealing with this kind of pain?
Oh, for probably a couple of years prior to that.
Years.
On and out, on and off.
Yeah, yeah. And then we noticed that that you have a problem with some of the disc in your back, and we decided it's time to fix them.
Exactly. We had tried the physical therapy first, and then they just decided I better have an MRI, get a closer look. And then that's when they scheduled an appointment to see you. We looked at the MRI and you showed me the pinchers and the L3, L4, L5.
So we did practically decide that we want to go after 2 of the discs that were causing your problem.
Yep.
Just 1 to 10, give me a number. How bad was the leg pain before the surgery?
Oh, 10. Is that
10.
the worst?
How bad is it now?
Today,
Leg pain. Leg pain.
Leg pain, probably.
Not the back pain.
Leg pain, probably 2.
2? Okay. When did that 10 back pain go away? Just after the surgery?
After surgery, yeah.
Just right after the surgery?
Well, last night they got me up and walked at we got into surgery a little after 6, got back to the room a little after 9. They had me up walking, I think, about 1 o'clock.
And this is important information. It hasn't been even 24 hours since the surgery.
No, they had me walking after I got back to the room. Like I said, about 1:30, we went for a walk to the nurse's station and back.
Excellent. Well, now, obviously, it's just 1 day after the OLIF procedure.
Yep.
L3 to L5, so 2-level fusion. Our surgery was under an hour, and our blood loss was just about 2 ounces. So, and you're ready to go home today, I understand.
Yeah, if you sign the paperwork, I can. I promise you, I'll take it easy. I'm not a rock star again, but I'll take it easy.
Have you walked already?
Oh yeah, the last walk I went all the way down the hallway to the left and all the way to the end.
Yeah.
And then I said I better back to the room. I think maybe I pushed it a little bit, but.
Did you go stairs up and down?
They taught me how to go up and down the stairs. I only have 2 steps at my house, so that's a good thing. It's from inside the garage to the house.
And you asked me a question that I bet no others or very few other spine surgeons have ever heard from their patient. What did you ask me?
Dr. Bossi, all I said was, you said I shouldn't sit too long and I should walk. So I said, maybe in a week or so, is there a possibility my brother could drop me off at Christian Brothers Ford where I work at? We got a beautiful showroom. I can sit at my desk for about a half hour.
You can.
Get up and do a couple laps, sit down. If I get tired, call them up and bring me home.
So you ask me if you can go back to work in 1 week because you feel like that, and it is okay to do so.
Yeah.
But this is not the typical question a spine surgeon is asked, and that makes me happy that my patients are regularly able to ask this kind of question.
Yeah.
Even if they do demanding job, like if they are farmers or they go in 1/4 to 1/10 of the time that open surgery send the patient back to their work, this kind of surgery send them back to work in 1/4 to 1/10 of the time that open surgery is able to send them back. So that's a good question to ask.
And that's why I chose you, because I did research and people said, you got to go to Minneapolis, you got to go here and there, and you're right in my backyard.
Yes.
You're right in my backyard.
Well, I love to practice here. Good patient, good place, good hospital, good staff.
I doubt though that I'll be back at the cafe working in Erskine anytime soon. There's a lot of bending over there. But,
Yes. Well, thank you so much for the interview. Okay, I appreciate it.